Jigru Shrestha. I'm a third-year family medicine resident from Cleveland, Ohio.
And I am Dr. Stuart Yee, a family medicine resident, also third year at Hennepin in Minneapolis, Minnesota. Welcome to Selian Lutheran Hospital. I'll give you a tour.
In this building, we have our ICU patients and our surgery consoles. Let me show you around a little bit inside. So this is the nursing station where the nurses sit. And then this way, we have the ICU. We sometimes have our patient, if there's overflow from the wards, we'll keep them here because there's a private room. And then this way down here is the ICU. So when we come in here, we take off our shoes and we have to wear these sterile slippers to go in. And there's about 8 beds total in this ICU.
And this is where we have our morning report and chapel.
And here we have the clinic. So we have the doctors come in this way and there's doors leading into the rooms. And then the patients are triaged on the other side. So the patients will be around the corner. We can come in and take a look at the patient's rooms a little bit. So these are all different clinic rooms. We see there's one open right now. Appears to be busy, but when patients first come in, they're triaged by the nurses near the waiting room, and then they all stay in line until their name is called. So there's no specific time that their appointment is. They just wait kind of until the doctor is ready for them.
Here we have echo, ultrasound, EKG. We also have a CT scan, and patients come here for laboratory as well. Welcome to our medical wards. This is where we spend most of our time at Selian. We have it divided into a female side and a male side. Come follow me in. This is our team.
Introduce yourself.
Dr. Henry.
Dr. Selvin.
Hello, I'm Dr. Clement. I'm working as a registrar at Selian Hospital. I did complete my internship here last year, and now I'm just working as a registrar. I am so much interested in surgery, and one day I would like to be a neurosurgeon. So looking forward to this year, next year, probably, to join my residential program.
My name is Henry Mugasa. Yeah, I am an intern at Selian Lutheran Hospital. I've been here for about 4 months now. Yeah, previously I've been in China for my medical, for my med school. I've been in China for 6 years, 5 years in med school and 1 year as an intern there. Become a cardiologist. That's the plan.
So I'm Fina Roman Kimaria, 25 years. I'm a medical intern doctor. I've been here at Selian this is my 3rd month. I've studied Kairuki University in Dar es Salaam. Yeah. So far the plan is just to finish the medical internship up to November, which will be up to November, and decide on what specialty I want to study. Yeah.
And of course, one of my brothers who was at boarding school, one day he fell sick, and probably the doctors at that region or that school that he was didn't diagnose the thing that he heard or the condition that he heard in a timely manner, which made him to have complication post like the management. He was diagnosed to have an intestinal obstruction, which was managed in a delayed. It was delayed in terms of management, whereby he had some sort of complications, of which if we could be like diagnosed earlier, then those complications could not happen to him. So that thing made me like to feel like I need to be a doctor, and one day to stop all this, like the sort of delayed diagnosis, and to make sure that everyone like get appropriate management in a timely manner.
The desire to help people. So in Tanzania, we face a lot of challenges here when it comes to health. So yeah, access to health is quite limited, the number of people, and especially quality health services. So that's what actually motivated me to go into medical school and become a doctor, so that I can help my people.
I think I just wanted to be a doctor from childhood. So throughout my O level and A level, I also liked the science. So automatically I took that direction.
Well, for me, I take it like it's a very good thing. First of all, I'm so grateful and thankful to have you guys or any of the American residents come into our hospital. This sort of collaboration has the positive impact from what I've realized ever since I started working with them, and it's like 2 years now. So I got to learn a lot of things from them. They teach us a lot in terms of knowledge and skills. So I take it as a good thing that we really need to have. Like we need to keep it like moving. Yeah. The other thing is the thing like to improve is, I don't know about the schedule or the structure of the residents in America, but if you guys get a chance of the residents that get a chance to come to Africa, especially Tanzania, they should come more than one time a year. We would love to have them here because we learn so much. We learn a lot actually. So I think the thing to improve is maybe if I'm so much interested in research, and if there's a chance like to work with them in terms of researches, I would be very grateful one day.
So it's been a nice experience working with you guys, learning from you, seeing how you guys approach the patients. Of course, I understand it's quite different from how you practice in the US, but it's been a nice experience, I'd say. But when it comes to improvement on this relationship between Americans who come here, I'd say it's more of the teaching. Yeah, I'd like for that to improve more, so that we can get to learn on how you guys do practice medicine in that part of the world, and how we could perhaps merge it with how we do it here and see how we can offer a better service to our people here.
So far from Dr. Laura and you guys, I've had a good experience, good learning experience different from what we're being taught by the doctors around here. So you have a different approach in managing patients, which is kind of new and hard for us because it's new. So I think we are learning.
Yeah, as I said, I'm so much grateful to work with Dr. Stewart as well as Dr. Jugno. They brought something a little bit different, but what I'm so much thankful is like we were able to work together. So in terms of management of patients, I'm seeing patients as in patients, having the history, doing some examination, making the plan for the patient, discussing the investigation and everything. So that was actually good, and they added to us something that we lacked. One of it was like I can say we had a good teamwork. Yeah, we discussed patients very well and had good plans.
The thought processing, yeah, on how you approach the patients, how you think, in terms of problems and solutions and all, not just going, how to say, organically, and then you just go like how the books go and all that. Like you approach the patients based on how they present their problems and how you follow up on them, like as they stay, let's say for the inpatients, the weights part. So how they progress with that, how you track that. You don't just, I've experienced seeing here like, okay, you direct the patients, but you really don't follow on how the progress goes. But I learned from you guys how you make that follow up. So that's my biggest takeaway.
The thing I learned is the notes, clerkship notes, and how to manage patients in problem-wise.
I think doctors to patient ratio is not the way it's supposed to be. Yeah, I think if we get a chance like to talk with the authority, the hospital, the government itself, like we need more doctors. Yeah, we need more doctors. We have to work healthy. We have to make sure that we get time to rest. We have to make sure that we have time also to see patient like properly. Yeah, so I think this will change the outcome of what we are doing. Yes, in terms of money, sometimes we need to do a lot of investigation, but they can't afford. So we're just forced like to treat them with what they have. Yes, so I would love to late or if I had a chance like to talk with the authority, especially the hospital authority, like to make sure they reformulate their policies in terms of letting people do investigations even before the payment. Yes, and the other thing is like I would like to add the government like to intervene on this to make sure that they let a lot of insurance company like to be able to register people so that they can have insurance.
Making it easy for the doctors to practice medicine, be it when it comes to resources, availability of resources, and timely responses. For example, we had an issue of ventilations. So it's been 4 months since I've been here. I know the ventilators are here, but they're not installed yet. So, and with that also, I came across patients who really required to have mechanical ventilators, but they didn't access those. So it makes it hard for a doctor to actually practice. Yeah. When it comes to personnel also, increasing the number of health workers also would help, not just doctors, even the nurses, the medical attendants, to make it easy for the doctors to practice, because you would be rounding and then you don't have a nurse, or you want to do certain investigations, you don't have people to help you send the investigations. Like that's what the medical attendants do here, send the investigations, send the people to imaging and all. So you end up using a lot of time doing other stuffs that, if you had more people to do those, it could even increase your efficiency in providing services to the patients.
Starting from Selian, I think we need to improve on the amount of investigation. We are not investigating patients enough, and we don't have, it's not our fault actually, there are no enough resources or reagents for doing some of the investigations. And in Tanzania, we need they should increase the number of specialists in each department. Maybe in like the medical, we don't have a cardiologist, so it's even difficult to interpret the ECGs, the echoes. So I think we need that.